Hello motivators, welcome to Motives to Light, where I motivate to stay up, never down. My name is Becca. For those of you guys who do not know, on my channel I talk all things nursing, God, beauty, woman empowerment, and so much more. So today is a nursing video. Hello to my nurse fam. Don't worry, I did not forget about you. This platform was started simply because of my nursing journey, and I just wanted to talk more about my nursing school journey. For those of you guys that do not know, I am in graduate school and I am finishing up graduate school. Oh my God, it sounds so exciting. I just want to talk about how NP school was going, how NP school was, my mistakes that I made, what I learned, what I did not learn, and just answer some questions that you guys may be having in your mind that you guys cannot really say out here that I cannot answer. So I'm going to go straight to it. If you guys do not know, I am a tele-med-surg step down and psychiatric nurse. Most of my job came from most of those fields. So I wanted to talk about how was nurse practitioner school compared to a nursing school. I will say nursing school was definitely harder. Nurse practitioner school is just mainly like an advancement of what you already should know in nursing. I do want to say that you should definitely, if you are a newly graduate nursing school, nursing student, I do advise you to definitely make sure you have some type of nursing background before you jump straight into nurse practitioner school, because some of these things that you're going to learn is like an add-on into what you should already know. However, I have seen some of my friends that I know that are NPs right now, they did it. They went straight from nursing school and they went straight to nurse practitioner school. So if they can do it, you can do it too. But however, I am not them. Nurse practitioner school was broke. That is the best word I can say. I was broke in nurse practitioner school. I did not know that it's going to require so much of my time outside of work, outside of like my lifestyle, outside of friends, outside of family. It requires a lot. I was not expecting it. I was thinking that just because, you know, I'm already a nurse of 5 years, that maybe it's not going to be as hard as I thought it was. It requires a lot of time. I am in the master's program, so it requires a lot of like writing essays, a lot of like time management. So I did not work as much as I should have worked. I became broke. Okay, I was a broke nursing student. Now I'm a broke NP student. Yes, it was very difficult for me in the beginning, like time management and making sure that I have everything going on smoothly for myself. So I really must say that NP school requires a lot of your time. I won't say it's harder than nursing school. I will say it just requires more of your time, because you're doing clinicals. Not only you're doing clinicals, you're doing research, you're doing essays, you're having class, you have lots and lots of projects and lots of group projects. The master's program, the psychiatric nurse practitioner program, require a lot of like working together in groups, working together with people. You know, you have to like learn other people's personality and learn yourself. And look, I'm gonna be straight up honest with you. I was not the student that was like, okay guys, let's do this. I was like, okay, whatever you guys plan, let's go. However, if I noticed that my group was not the type of group that I was in that wanted to step up, I will be the one to step up. But usually I'm like, I back up first and see who is the leader, then I go from there. I don't like to be all the time just jumping in. But if I see something that I have something against, that I do not like, or doesn't require a topic that I want to talk about, I do definitely step up. So that summarized how was nurse practitioner, the psychiatric nurse practitioner program. It requires a lot of work hours. How was clinical hours? Okay, so my program requires like almost 100 hours per semester, and my semester usually is like 3 to 4 semesters. So you have to like find ways to work and also like find ways to like make your work schedule fit your clinical schedule. For most of us nurses that are going to advanced nurse nursing school program. We're still working. We still have families. We still have to take care of our friends, our families, our loved ones. And if you don't find ways to work your clinical around their schedule, or work the clinical around your schedule, you're going to find yourself exhausted, tired. So clinical hours require a lot. Now, one thing I can say, when you are in clinical, make sure you're writing down lots and lots and lots of notes, because you will get so overwhelmed from seeing all these patients. When you do get time to do your evaluation, your assessment, and all this stuff, your diagnosis, it's going to be hectic. So that's one thing that nursing school did not have. So that's one thing that nursing school, RN school, did not have compared to the nurse practitioner school. The nurse practitioner's clinical, now you're diagnosing. Now you're like thinking outside of being a nurse, and you're actually like putting all the symptoms together, and you have to like come into conclusion like, okay, this is what this patient is coming in for. This patient has type 1 personality disorder. This patient is here for anxiety. This patient is depressed. Or what type of depression? Is it major depression? Is it minor? So you have to really, is the depression based off of a situation the patient is going through? So you have to really evaluate the patient. So having notes in clinical is so important. So when you do go home, okay, this patient, I need to know about this patient. This patient came in for this patient came in for that. So clinicals is definitely so different from clinical in the RN program. It is not like care plan. You are like the provider. You are the one diagnosing. You are the one doing all of these things. So you really have to like think outside of a nurse. You were still working under a provider. You're still a registered nurse, but you're just more advanced. So clinical, when it comes to clinical, you really have to focus on the patient, the diagnosing, and most importantly, the medication. You have to, especially for psychiatric nurse practitioner program, you have to know your medication like the back of your hand. Like the medication is the most important thing I would say that you have to know. Which leads me to my next point. What is the most important thing that you have to know in nurse practitioner schooling? And I would definitely say medication. Medication. I cannot emphasize that enough, how important it is, because you are playing with the most important thing in the human body, which is the brain. The brain is so important. It's how we think, it's how we eat, it's how we do everything in our life, it's how we move. The brain tells us how to do everything. So if you make a little mistake and you give a patient a medication that is just can either make the medication make the patient go high, go low, you will regret it. So you have to make sure you know. One of the biggest thing I can say is make sure you know your medication. I am still to this day learning a lot medication. I want to know, I don't care if it's just 200 medication. I want to know all of them. I want to know all their side effects, because I'm going to be prescribing this medication for my patient. So I definitely will say, make sure you know your medication. Hours of class. So my hours of class, I'm in class all day. The hours of class, like sometimes is 4 to 5 days per month, and in those 4 to 5 days you are in class all day from morning to night. Not only are you in class, after class you also have discussions that you have to do, discussion questions. Oh my gosh. That's one thing I did not like, was those discussion questions, because you have to not only talk about your own perspective about how you feel about a situation, but you also have to respond to like your classmate, and it can just get tedious. It can just be like, ugh, but hey, it's part of the master's program. So hours of class was long, was tiring. You are going to require a lot of vitamins, a lot of like coffee, a lot of energy drink to just keep you awake, because some of those classes can just be long, and some of the things that you're learning you have already learned before. I will make a pros and cons video on psychiatric nurse practitioner program. However, I'm just going to strictly talk about my experience in the program. You will get tired and your brain will get exhausted, so you have to like be eating those snacks, girl. boy, you gotta get those snacks ready. You gotta get the coffee ready. You gotta get a lot of things. You gotta get a lot of those things ready. So just wanted to just talk briefly. When you work while you are in the nurse practitioner program, absolutely you can work. However, you might only just work like 2 days a week. Like for me, I did take out some loans because the program did get hectic at some point of my program. As you know, I am taking care of myself. I do not have no kids, no family, and no husband to be like, baby, just can you help me out here? No, it was all me. So there's some days I definitely had to like work. I had to still work, and I had to switch my schedule. I am a day shift nurse. I had to switch my schedule to a nighttime nurse because night shift I was able to like a little bit like, you know, get some studying here and there during downtime. I would listen to some like, you know, audios during my downtime. So I had to switch my schedule to night shift, but I was also still doing day shift at the same time. Y'all, don't ask me how I did it. Is the Lord, because trust me, there was days I was like, I don't know if I'm gonna push through. I don't know if I'm gonna make it through the program. Another thing, you need a supportive system into this nurse practitioner program. You need to make sure you are in a group. To be honest, I could not do it without my program, the people in my group. Shout out to all of y'all. You guys are a blessing to me. They will remind me, hey Becca, did you turn in this assignment? So make sure you get yourself into people that like you, people that are not gonna hide things from you, people that are gonna help you through the program, because you're gonna need it. You cannot do this program by yourself. You're gonna need it, because especially sometimes life things happen. Like for me in the nursing program, I went through a breakup, so there was times I was like, oh my God, I didn't feel like studying, I didn't feel like doing any of that stuff. But my group members definitely helped me. They definitely helped me. Even some of them was helping me go through like my healing process. They was motivating me. They was like consoling me. So you truly need a good group. So I would definitely emphasize having a good group. Look, when you go into class orientation, look at the people that you can, you know, personalities match each other. Like, you're gonna need it, because things happen. Like this 2-3 year of program, things are going to happen. Your child may get sick, or this may happen. You may go through this, you may go through that, and you need a supportive system. So having groups is very, very important. Another thing, did I have experience in psych before I started the program? So before, I was a tele-med-surg nurse, medical, but I always had passion for psych. I did have a little bit of experience based on the hospitals that I worked at. But when I went into the program, I was like, okay, clinical is not enough for me. I need more experience. So I went straight. I started learning everything about psych. I started working in psych more effectively, more hours into psych. I worked more, even though there was some pay that was even lower, because psych is a little bit easier than medical, I would say. The cut was a little bit lower. I did not care. I wanted experience in psych, and I fell in love, absolutely fell in love with it. So I did want to get experience, and I do advise any of you guys that wants to do psychiatric nurse practitioner, do get your experience, because clinical is not going to be enough, because you need to see what also the RNs are doing, what they're how they're assessing the patient, what they are calling for, because they're going to be calling you if a patient is acting up, a patient needs Ativan, a patient needs Haldol. They are going to be calling you, hey, so and so is doing this way, their behavior is this way. You need to see behind the provider see, because I'm telling you, as a nurse practitioner, as a doctor, as a provider, they are in and out. The eyes and ears is the nurses. So if you as a nurse already know what you're looking for, it's going to be way more easier for you when you do start your practice. So I do advise you, this is the best advice I can tell anybody. Make sure you have experience in psych before. Make sure you have experience in psych before you get into the program, or while you're in the program, sign up. Go get your experience as a psych nurse, as a psych nurse, because you are going to need it. You're going to need that knowledge, especially seeing all those medication that providers, you're going to need it. And it's also a good way to see the doctor's notes, the NP's notes, so you can have the back of your mind, okay, this is what I'm going to be writing. This is what I'm going to be needing. So I do not regret having experience in psych, and I'm absolutely grateful that I have experience in psych. I'm actually going to work tomorrow in psych, and I absolutely look forward to it. So I gave up a little bit of the medical side, then focus more into my psych. Did I regret going to psychiatric nurse practitioner school versus NP school? Absolutely not. This is the best experience I can say I gave myself. I am so happy I did this while I was by myself, while I was single, and I didn't have no kids, no husband, nothing, because y'all, let me tell y'all, I don't know how I would have done it if I had a baby crying, a toddler, if I have a husband that needs me to cook, and I have this that needs to be done. I would have been like, forget all of y'all gonna take care of yourself, because I cannot do this. So I am so grateful. Shout out to all the mothers, wife out there that are doing this program, because I don't know how y'all can do this. I am not that. I am I barely made the program just by living just by being alone, because I guess the load of just being by yourself, so working by yourself, doing everything by yourself, paying all the bills by yourself was crazy enough. So I cannot imagine doing this with a family. So I am so grateful. I do not regret it one bit. I do not regret not choosing FNP. When I'm hearing all what my new grads, the new grad psychiatric nurse practitioners are making, it just motivate me, like, okay, yep, I'm gonna be making that an hour, I'm gonna be making that in a day. So I am so grateful that I did psychiatric NP. Not only that, is because I have so much passion in hearing people's problems, so much passion in hearing what people have to say about what's going on in their mental health. I also was somebody that struggled in the past with depression. I struggled in the past with anxiety. So I'm so excited to just share how I overcome it, to talk to people, to hear people go through stuff in life. I don't know, I just find it exciting to hear people's problems, and I think my patients, even in the medical field, they can see that. They're always talking to me about their situations. I'm always talking to my co-workers about their relationship problems, or what they go through in life and how they can overcome it. So I am so excited for this new journey. So I absolutely do not regret it one bit. I know that some people may be like, well, you have so much experience in the medical field, how come you did not go into FNP? Because FNP, I realized when I did my job shadowing, was just not for me. And I want to do something that I love. I want to have passion for it. I love to talk to people. I love to hear people. I love to just do things that people do not do on a daily basis. So yeah, I do not regret going to school for a psychiatric nurse practitioner. So that's all I have to say. Thank you so much for watching this video. Stay tuned for the pros and cons that happen. That I will say, there's some drama that happened in NP school that I was not expecting, but it happened. So stay tuned for that video, and also stay tuned for my nurse fam for the next video that I'm going to post, which is ways that people fail in nursing school and how to overcome it. I need to talk about that, because I'm seeing I'm still getting emails on people failing. So I'm going to talk about ways that the top reason that nursing students fail out of nursing school and how to overcome it. Thank you so much for watching my video. If you need a one-on-one with me on how to be successful in NP school, do hit me up privately. We can talk, and I can tell you how I learned. Did I go to a private school? I went to a private school. I don't know, private school are more easier for me versus public school, but they do have public school, but you still have to do pay because it's an advanced practice. So thank you so much for watching my videos. Please like, subscribe to my channel. You will see a lot of my journeys. I will show you in the future how I'm working as a new grad, as an NP. So I'm excited for this new journey. The next video that you probably see based on psychiatric nurse practitioner will probably be my graduation vlog. So thank you so much. Have a great day. Bye.